Hey everyone, welcome to the show, My So-Called Fabulous. I'm Tiffany, and today, y'all, we are diving in. We're diving into a topic that's changing the landscape of modern mental health. Functional psychiatry. And before I really dug in deep with my guest today, I started stalking her, that we do on social media and her website, and to see what's going on, because I had no idea this is a thing. I'm going to read this because I will butcher it, because I'm not Everest at all. We're unpacking everything from serotonin myth to gut health to micronutrients to hormonal shifts to the scene behind brain detox. We talked about brain detox many times on this show. If you wondered why traditional models sometimes fall short, how nutrition, hormones, and even mitochondrial, don't even know what that means, health plays a role in your mood, you are going to listen today and come out empowered. Welcome to the show, Everest Goldstein with Evergreen. So you are functional health and nurse practitioner and all the things, and your resume is amazing.
Oh,
welcome to the show.
Well, thank you, Tiffany. I am so excited to be here. I'm a functional medicine, functional psychiatric nurse practitioner, and I have my Everest functional psychiatry practice, and then my colleague Elise, who's also been on the show and is fabulous. Her and I started Evergreen Functional Collective, which is a more general functional medicine clinic. But I'm just so honored to be here and talk with you. And
well, thank you for being here. And yes, Elise has been on the show multiple times because you gals are a wealth of information in an ever-changing medical world. I mean, the changing of the world, I know your father's a physician, if that's right, and just the changes that he's seen, the changes you've seen at a very young age is amazing. So let's dive in. I have to admit, when Elise told me last year that you guys were in business, and I said I didn't know this was a thing. Psychiatry in the functional level. We need it, right? Why do we need this so bad?
Yeah. So, I mean, it's kind of unfortunate, but it is growing. There's not a ton of people doing true functional medicine and functional psychiatry together. So, really taking that more integrative approach to psychiatry, which is super important in my mind because there's something called the brain body connection, right? I feel like we've all heard it. But what does that really mean? Well, what's so important to recognize is so much of what's going on in our brain or in our mental health is connected to what's happening in our body. And we need to really look at like what the root cause of mental health conditions are, what the root cause of mental illness is, and treat that as opposed to just putting a Band-Aid on the problem or giving somebody a medication, and that we don't really know like why it's working or it's not really targeting that root cause.
Right. And it's just, I think that psychiatry, we do this with, how am I saying it? Pharma.
Mm-hmm.
That's right. I mean, Elise and I were talking about, there was a decision, should I get on Wellbutrin for a certain phase of this life? I'm postmenopause. And my functional wellness doctor said, let's do 50 milligrams of progesterone, the dissolvable progesterone. Wow. Because I have been on Wellbutrin, and there's a space for that, right?
For sure.
Of course. But what a difference, right?
Definitely. And I think that's such a good point because, like you said, there's a time and a place for medications for, certain treatments. And I definitely utilize those in my practice. So I like to mention like functional psychiatry, it's not getting rid of conventional medicine, right? It's getting to the root cause of what's going on, looking at mental health disorders like depression or anxiety or insomnia as symptoms and figuring out how we treat the root causes of those symptoms, as opposed to like, this depression is a diagnosis and all you can do is use Wellbutrin or an antidepressant. So really trying to get to the root cause. So like it sounds like for you, especially as females, when we enter different stages, our hormones change. And so a lot of times addressing the hormonal changes is what's going to really improve the mind and your mental health. Whereas like Wellbutrin might have given you some symptom relief, but it's not actually addressing the hormone changes. So you're still going to have a lot of other symptoms going on, right? So just figuring out like what is driving that change and mood and anxiety and, mental clarity, whatever it may be, and treating that, which may be medications. It may be Wellbutrin. It also may be hormones. It may be thyroid support. It may be gut health support. It may be lifestyle support. It may be all of the above,
Right, right. So how do you know when one of your patients comes to you, how do you know which way to go? What is the first step you take? Let's say they have postpartum depression, or I don't know if you treat, puberty. What are you treating? And is it mostly women?
Yeah, so I see all ages. My backstory, I used to be a bilingual elementary school teacher, so I love the kiddos. But I do see probably mostly like adolescents and then adults. And then I have some pediatric, patients and clients and whatnot. And I see most anything non-acute. So I have people come to me for, they've never heard of functional medicine in their life. And they're like, hey, I'm really struggling with ADHD or anxiety, or, they may not know what's going on. They're just like, I'm just really struggling. I need some psychiatric help. And then I also have people come to me who are the opposite end, and they're like, I'm having a ton of gut health issues, or I'm really struggling with hormonal issues, and I don't really know what to do. I want a functional approach. And what I do with every client is I do a very long initial consultation. That's a big assessment. So no matter if you come to me for just ADHD or just gut issues, most of the time there's some you're having physical and mental health symptoms going on. 'Cause even if we're chronically ill with, for example, I had Lyme disease. So even if you're chronically ill with Lyme disease, that takes a toll on your mental health at the same time. But we do a really big assessment. And really the point of that is to get to that root cause. So I'm asking questions from, what's been going on in their life from even before birth until now. Where did things change? What have they been exposed to? What has their childhood looked like? Is there any trauma? What is going on with their diet, their gut, their lifestyle, what toxins have they been exposed to, all sorts of things to see if we can figure out and kind of peel back the onion to see what's going on underneath the surface.
Share with us some of your success that you had in treating patients. What if someone can you help someone with ADHD?
I had someone ask me this earlier actually, and my answer was, I believe yes. From my experience with what my patients have told me, I've seen amazing improvements that they've been told would never happen to them. And I think my approach is if somebody's not getting better, to me, that's a sign of like, hey, we need to take a step back, peel back that onion a little bit more and figure out like why you haven't fully improved, right? My job is to make myself have no job. I want my clients to like graduate and move on and live their life again. And so, and like maybe we meet, I meet my functional provider every year just for maintenance and stuff like that. So I think that's a different story. But if I don't want them to feel like, oh, we need to be, I'm struggling so much that I need to see a psych provider every single month for the rest of my life and still feel pretty crummy. So, there's a lot I've had people, I had someone come to me from the psychiatric hospital, and she'd been to 3 different psychiatric hospitals in a year, had been put on all different medications, still really struggling with mood, insomnia, all of that. What was going on, she had a really bad bacteria and also a pretty serious parasite in her gut. We treated that. She has been off of her medications totally fine for about 4 years.
Whoa.
And I check in with her every 6 months or whatnot, and she's doing great. So that's kind of like just one example. But, there's also, kiddos with, ADHD, like you mentioned, or adults who are struggling with ADHD. And when we really get to the root, and then have them work on different lifestyle adjustments. So maybe adding in exercise, removing what I see cause a lot of ADHD symptoms is different like allergies or food sensitivities, as well as exposures to things like maybe mold or, some heavy metal that they've been exposed to. And when we actually treat that, a lot of times their symptoms go away, and they can kind of focus in class again and live their life. So, I do definitely see improvement. And I think that a big part of that is because I'm trying to take a step back, get to what's driving these symptoms and correcting that, as opposed to just putting, a Band-Aid on it.
Absolutely. So we talk about the gut-brain connection. What do you do to clean up the gut? Because I told you before the show, and I've shared this with everyone, thousands of people, that I was before I was diagnosed with breast implant illness and did all of the tests. And they were expensive. It was the heavy metals, the mold, parasites. Started cleaning that up, and I'm still cleaning it up. How do you clean that up in one of your clients?
Yeah. So I am a big fan of, again, when it comes to gut health, so many different things could be happening, right? Like it may be that we're not digesting our foods well. It may be that we have, candida overgrowth or, dysbiosis, like an imbalance of good and bad bacteria. It may be that, we aren't producing certain enzymes that will help us break down certain foods. It may be that we're reacting significantly to certain types of foods. So figuring out, and there's different tests you can do for that. Also looking at just symptoms, figuring out what's off in the gut and then restoring that, as well as just restoring, I would say, like stress resilience, right? Because the impact of stress on the gut also has a big significance. So if we do all this work on the gut and we're not restoring, how our mindfulness, if we're not changing our lifestyle in that way, or even changing our diet, if that's part of the problem, then once we do all the work on the gut, our gut's probably going to go back to kind of a bad state again. Mm-hmm. But I really like to take what's called the 5R approach when treating gut health. So we're removing pathogens, or, whatever's causing the problem, whether it's a food you're allergic to or, killing the candida or the bad bacteria or the parasite or whatever it may be. And then we're, restoring the gut, the stress relief. We're restoring, the gut lining. So really doing gut support, kind of soothing those symptoms as well. We're replacing nutrients that are deficient, whether that's digestive enzymes, whether it's, certain nutrients that we haven't been able to absorb very well. We're re-inoculating with good bacteria. So adding in those good pro and prebiotics. And, just doing kind of a full foundational approach to get gut health restoration and keep it.
Right. Is there one size fits all when it comes to diet?
Not in my opinion. The one thing I will say to that is I'm a big fan of like whole real foods, right? Mm-hmm. So if we can focus on what comes from this earth, getting real foods, looking at the outside aisles of the grocery store, that can do wonders for us, right? Making sure you are getting enough protein, healthy fats, fiber, carbs. Like my approach is that nothing's really should be labeled as bad. Mm-hmm. But there's, when it comes to specific diets, I don't think there's a one size fits all. Right. For example, I have celiac disease, so I should not be eating gluten, but that's not the case for everybody, right? Or some people may have a dairy allergy and they shouldn't be eating dairy, or that's going to cause symptoms. But again, I don't think dairy should be off limits for everybody. There's a lot of benefits to it. Mm-hmm. And then we look at specific diets. And when you look at research, in mental health particularly, the most supportive research is around the Mediterranean diet, which is really just a whole foods diet, right? With healthy fats, eating, enough fruits, vegetables, protein, fat, that kind of thing. And it's a pretty generic, broad diet. There's also a lot of research around the ketogenic diet for curing, specifically, conditions like schizophrenia, bipolar disorder, even a lot of improvements with depression and stuff like that. But at the same time, I don't think that everybody needs to be on one or the other. It's kind of like what fits in with your life. And also what allows you to enjoy life, right? There's so much that we don't value with that necessarily, and we need to think about more. So if somebody's going on such a restrictive diet that they can't, or they feel like they can't go out and be with friends and family, then to me, that's not a great diet either, because we get so much from that communal connection.
Mm-hmm. Absolutely. The social part as well. And social isolation is a huge problem, isn't it?
For sure.
I mean, really. So why are we seeing such a rise, or are we just so now, but social media, the internet, it seems like dementia is a huge issue, and Alzheimer's.
Yeah.
What is going on?
It is. I would even say it's almost an epidemic at this point. And what's really fascinating is rates of dementia are significantly increasing. But I would say that about a lot of diseases over time. And, there are some, I actually was just speaking at a functional mental health conference in San Diego, and there were some top doctors in the dementia world there, and they have been doing protocols, particularly actually going back to diet with like the ketogenic diet and then lifestyle changes. So incorporating like exercise and then certain nutrient supplementation and stuff like that. And they are seeing reversals in dementia, which is amazing because so much of history has shown that like dementia, Alzheimer's, things like that are irreversible. And again, it goes back to that root cause, right? So if we can kind of support somebody in terms of what's causing these symptoms of dementia, how can we reverse that, or slow the progression of the disease, we can make a huge difference in their life.
In prevention, my eyes are wide open. So many people in my life are struggling with this. It may be with a parent or a spouse or a friend. There's got to be for prevention. There just has to be.
And I think that's where functional integrative medicine succeeds. So like you mentioned, my father's a physician. He's an amazing surgeon, conventional medicine to the core. And what I have so many conversations with him, right? I remember I told him I was going into mental health and he's like, wait, what? And then I was like, oh, and I'm going into functional medicine. And he's like, who are you?
Right.
But now, it's really great. He incorporates functional approaches. I take what he's taught me. It's really awesome. But what I think we've kind of talked a lot about is conventional medicine is amazing for acute illness, treating conditions that, if somebody's really struggling or they already have a disease or they're, dying, please don't come to me.
Right.
I want you to go get the life, there's a time and a place for surgery, antibiotics, all the life-saving things. But we want to prevent that from happening in the first place, right? And that's not always possible, but that's where, you're not going to go to the hospital to tell the doctor at the hospital, hey, I'm really healthy. I want to make sure that I don't get dementia. Or I'm really healthy, but my mood's a little bit off. What can you do for me? You're not going to go to the ER to talk to them about that. Mm-hmm. So we need to step in at that point and be like, okay, what can we tweak? What can we optimize in your life so that you have your full wellness restored, and that you can continue on living that way before it gets to the point of diabetes, of liver disease, of cancer, that
heart
kind
disease,
of thing.
all the things. And isn't it exciting that we're here. We are it seems like we are a prevention world now. We
Yes.
want to prevent. And then we
Yes.
have people and gifts like you and Elise that definitely can help, of course. So there's a phase in my life, I was probably in my 30s, and I had adrenal fatigue and severe adrenal fatigue. And it was a booger bear. And
Oh, yeah.
talk to us about that, because I bet you see that
Oh, yeah.
in this world.
Oh, for sure. And, I've struggled with that. I think the way I like to describe it, because this is something that I see with my patients probably at least once a day. And I think, when we think about our bodies, so our bodies, we have adrenal glands, which are organs that produce cortisol, or I like to say our stress hormone, right? We think back to like the caveman days. If we saw a tiger or some sort of threat, our body starts to produce, our adrenal glands start to produce cortisol. It puts us into that sympathetic fight or flight state. And our body gets ready to fight or flight, to run away, right? We want to protect ourselves. So our digestion slows down. Our hormones aren't, our body's not prioritizing hormones at that point. Where our pupils are dilated, our heart starts racing, we're ready to go. Well, then, we run away from the tiger and all is well back in our caveman days, and our cortisol normalizes. We want some cortisol. We just don't want a ton all the time. It normalizes. We go back to our daily life. Our body cannot distinguish the difference between a tiger chasing us and another stressor, like somebody cutting you off in the road, or feeling like you have work deadlines that are never ending. Kids screaming in your ear and you're trying to make dinner, whatever it may be. We're living right now in a world where we are chronically bombarded with stressors, right? Our phone goes off and like every notification that kind of sends a signal to our body, that kind of thing. We get an email that's like at 8 p.m. and they're telling you have something you have to do by tomorrow. So our body is a lot of the time, and I feel like women are very susceptible to this, is chronically producing cortisol. So we get into this high cortisol state and people start to feel that wired but tired feeling, like ton of anxiety, may even just feel like fatigue, the energy crashes throughout the day. And our body will do that it doesn't feel great. We call that stage 2 adrenal fatigue. And that will happen for a certain amount of time before our adrenal glands are like, hey, I don't have any more cortisol to give. I'm just going to now like kind of give up. Our cars run out of gas, starts underproducing cortisol. And we really hit that stage 3 fatigue feeling of like, can't get out of bed.
Yeah.
I really don't feel well. And, that shows up a lot of the time as one, anxiety, fatigue, also severe depression, right? So what happens is a lot of people then go to their psych provider and they're like, hey, I have no motivation. I can't get out of bed. I'm really tired all the time. What do I do? And they're like, here's your antidepressant, your SSRI. Well, what's important to note is that SSRIs actually lower cortisol more. And we're not necessarily taught that in conventional schooling. I didn't learn that in nursing school, originally. So it's no provider's fault that they're just giving SSRIs. And SSRIs can maybe help if you have the high cortisol depression, right? But once you get so low, those are the people who they take antidepressants, they're not working or they're feeling worse. And what's the next conventional treatment? Just to use a different antidepressant. So, adrenal fatigue, there's so many parts at play. We really need to figure out where in the 3 stages you are. And then how do we kind of boost that? And we can do that a lot of different ways.
We can. And how is that? What do you do?
Yeah. So I love to get what's called a salivary cortisol test.
Spit in the tube.
Yep. They give you a couple tubes. So your cortisol changes throughout the day. So you really do have to like spit in a tube maybe 6 times throughout the day. It's not the most fun.
No.
But gives you great data. And you can see like where in the day your cortisol's off and how it's off. So some people may have high cortisol in the morning and then maybe it drops in the afternoon. And so you want to use lifestyle and also supplemental tools to treat the cortisol accordingly. So you can use, there are certain like herbs and botanicals that will lower it or raise it. Also making sure you're getting like morning sunlight can be really, really helpful there. The importance of sleep hygiene can be really helpful. Making sure you're not like under eating or working out too much. That can make a big difference too. And then also working on those mindfulness tools to move your body from that sympathetic fight or flight state to your parasympathetic rest or digest state. So
all of those things you listed back in, and I feel myself getting in the trap again of that, not eating, working out too much, cause it's released my stress. Well, sleep hygiene. Last night, I left my phone off and the notifications on just because I had to do a lot of things. I was up all night. Ding, ding, ding. You would just not believe how many people actually do text at night or notifications. And so I could just feel myself stress. I won't do that again. I will not do that again.
I have done that. And, there's so many things that I preach and I'm like, and I tell my patients, hey, I'm working on this too, right? Like one of the big things I've been really trying to focus on that I think has made a big difference is not looking at my phone messages and emails right when I wake up. So now I'm doing like waking up and doing even just like a 5 to 10 minute meditation, brushing my teeth, drinking a glass of water, and then I'll turn on my phone, as opposed to like I used to turn it on right away and then all of a sudden there goes my cortisol, right? And you can feel it.
Oh
yeah.
I'm telling you, it's a thing.
Oh yeah.
It's a thing. I'm queen. Okay. I want to ask you this because I talked to you about, I've done the detoxes. I've done so many. Big one was Cellcore. It was tough on me. It was very tough on me. But man, did we make a difference. We moved the needle in my detox. How do you detox the brain and the gut? I did it with Cellcore. Is it supplements? Of course, you said food and things like that. But my big thing, it was supplements, and it was tough, y'all. I'm just not going to sugarcoat it at all.
Yeah, detoxes can be really tough on the body. I think we also have to be careful of like when we're doing it, right? Pregnancy, breastfeeding, not the time to be detoxing.
That, but...
Yes.
I'm good.
Move past that. Yeah. So, I do it in a multitude of ways and also depending on the person. So there's 2 phases to detox. Phase 1 is killing the whatever it is for essentially. So or like releasing whatever it is. So, if you have candida or like yeast overgrowth, you want to kill that at some point. That's phase 1. Or if you have mold that's kind of been in your body, you kind of get all that ready to be released. Phase 2 is the elimination of whatever you're detoxing, which the biggest ways we do that are through, stool. So pooping. I'm just going to say it.
Yeah. We say it all the time over here.
And then, also sweating. That's another big one. And then, also we do detox, other ways we eliminate things, but those are the 2 big ones. And so we want to prioritize phase 2 first. And that's my biggest thing with detox that I feel like is sometimes missed, because think about it. If we have some pathogen that we're killing, if we kill it in our body, what happens now? Well, now it's just circulating in our bloodstream and we're going to start to feel really crummy and we may reabsorb parts of it. But we need to be able to eliminate it pretty quickly. And if we're not pooping daily, if we're not sweating throughout the week, then that toxin is now just circulating throughout our body.
Yeah.
So really making sure our detox pathways are opened first. You're having a bowel movement daily. You may go to the sauna or the gym, or maybe you live in Texas like us in the summer and you just walk outside for 5 minutes and you start sweating. And then really working on how do we, kill whatever it is. So through supplements, diet is also key, right? We get a lot of toxins from foods and stuff. So making sure you kind of clean that up. And there are certain foods that help with detox, like cruciferous vegetables, that broccoli, cauliflower. The biggest one is actually broccoli sprouts, biggest bang for your buck there. And then obviously one of the biggest things that I didn't mention, probably the first thing to do is, can we remove the toxin from our life? So like you know, with breast implant illness, can we remove the implants? Because if you do this detox and they're still there, well, the symptoms aren't really going to get better. Or if you're living in toxic mold and you can detox, but the symptoms, unless you like remediate your home or move to a new place, you know, you're just going to keep being exposed to that toxin.
Right. That is amazing, because we are surrounded with the toxins.
We are,
for
yes.
sure. What's your vision for psychiatry in this space? What is your vision? Just jump ahead 5 to 10 years and then the next decade.
Yes.
What do you see?
Well, personally, I'm working on, fingers crossed, an exciting project that will kind of expand, my functional psychiatry practice clinic. But so stay tuned for that. But to be able to like reach more people, educate more people as well. My vision in general for functional psychiatry and psychiatry in general is that, one, in conventional psychiatry, we're taught and we practice in a more holistic way. Now, I know like that doesn't mean functional for everybody, but like that we're assessing even, you know, the basics of vitamin D, asking people about sleep, exercise, those things that I have so many clients that have been in psychiatry or like have been seeing a psychiatrist for years. And I'll ask them about, have they ever exercised? They're like, wow, no one's asked me that before. Or, you know, how's, you know, like, what is you walk me through a day of eating and drinking? They're like, oh, I've never really had to think about that.
Oh dear.
So just getting, you know, having that, and that's not everybody, but it definitely is something I think we need to really focus more on in psychiatry. And then having more people also go into functional psychiatry. I love when I hear people that reach out and they're like, I saw you do this. Like, how did you get into it? And for me, honestly, there's not like one way. I had to figure it out. But there are more tools, more programs now. And I would love to see like people get into this field so we can help more patients.
Absolutely. That's the bottom line, isn't it?
Yes.
I know. And I can tell. My goodness. That was right. You are absolutely fabulous. I'm so proud of you girls for what you're doing in this space, helping people. It's just so apparent. I mean, it's nice to meet you. And then of course I've known Elise and I was with Dr. Leanne Scott for years. And so, yeah, it's a beautiful thing watching you help people.
Oh, well, thank you. Well, I owe so much to you too. One, it's been such a joy being here, but, also you're like, these are the things that educate people, right? You bringing people together on your podcast is just amazing.
Well, thank you. Well, thank you so much. Well, tell us how we can find you.
Yeah. So you can follow me on Instagram. I'm Wellness with Everest. I have a website. I have Everest Functional Psych, .com. And then also Elise and I have our Evergreen Functional Collective. And then, you know, you can reach me on any of those things. I love when people reach out to me. So shoot me a message on Instagram, message me through my website, and would love to connect.
And I know these girls mean it. When they say reach out, they absolutely mean it. So, well, thank you for being here.
Thank you, Tiffany.
And everyone, thank you so much. I'm so happy we could share this with you. That's what we're trying to do over here at Fabulous Network. We are trying to help. And I say this every single Tuesday. Keep being fabulous.